On this Thursday night, the dire need for medical supplies for our healthcare workers. The Prime Minister says help is on the way.
In the coming days, we will be receiving millions more items.
Who is helping and what are they sending? Plus, new details on travelers who land in Canada and could be quarantined. New York, overloaded and underprepared.
9/11 was nothing compared to this.
The extreme measures medical workers there are forced to take. Beefing up border security, why the U.S. president thinks Canadians are a threat during this pandemic. And mounting pressure to plank the curve.
We're forced to treat and learn at the same time.
Successes and failures in the fight against COVID-19.
Global National with Donna Friesen.
Good evening and thanks for joining us. There are lots of developments again tonight. Here's where we start. The COVID-19 pandemic has reached another alarming milestone. The number of global infections has now surpassed 500,000, and here's another shock. The United States now has the most cases of any country in the world, more than 83,000, which means it has surpassed China and Italy. In Canada, more than 4,000 people have now tested positive, and though social distancing is expected to help in the coming weeks, right now the virus is still spreading fast. In the face of that, frontline workers around the world are running short of protective equipment. In Canada, some hospitals are already rationing masks and warn a severe shortage of things like masks, gloves, and other protective supplies is imminent. Today, Prime Minister Justin Trudeau promised help is on the way.
And in the coming days, we will be receiving millions more items that are necessary right across the country.
Back in February, it was Canada that was helping others. The government sent 16 tons of personal protective equipment to China when cases of the virus were surging there. Now, it's the Chinese who are preparing to send us supplies. Our chief political correspondent, David Akin, has new details tonight.
When China was scrambling to deal with the initial outbreak of COVID-19, Canada stepped up to help, sending all kinds of medical equipment to Hubei province.
We recognized from the very beginning that this is a global crisis that requires global cooperation and response if we are to keep all of us safe.
Indeed, and China is thinking along the same lines. Because now that Canada is scrambling to contain its own outbreak, China is stepping up and is preparing to send Canada millions of items, ventilators, surgical masks, shields, and so on. In the meantime, the Canada Revenue Agency, or CRA, is revamping its website to accept applications for the new Canada Emergency Relief Benefit that will pay those losing income because of COVID-19 up to $2,000 a month for 4 months. It's a massive job. The CRA expects as many as 4 million Canadians to apply when the CRA web portal is up and running sometime around April the 6th. The Prime Minister and Premiers also hammered home the new mandatory self-isolation rules that are now in effect for those coming in to Canada.
All travelers, if you're coming home, you must go directly home and self-isolate. I think it's critical that people fully understand that. That is not stopping at the grocery store. That is not stopping at the post office. That is going directly home and isolating for 14 days.
And there are consequences.
If you do not comply with these instructions, you could face serious fines and even prison time.
So, David, a tougher message again today, but what about travelers who arrive on planes or at a land crossing who are sick? What's happening to them?
Yeah, lots on that today. Well, those who are sick and can make it to their home in their own private vehicle, they can do so, but they have to register with public health authorities, and they are going to get regular visits to make sure they are staying in isolation for 14 days. Now, those that arrive at the border with symptoms who can't make it home in their own vehicles, and this would include those who arrive on an international flight who need to make a connecting flight to somewhere else, well, they're going to stay right where they are, and they will end up in a government quarantine facility, likely an airport hotel for 14 days. Right now, though, very few travelers in that situation. Dr. Teresa Tam said today is just one person in Vancouver and one couple in Quebec in that situation, Donna.
David Akin in Ottawa, thank you. Here's where Canadian infection numbers stand tonight. More than 600 new cases have been reported across the country. Quebec reported the biggest spike, 290 new cases, bringing the total in that province to more than 1,600. In Ontario, there are now 858 confirmed cases. Of those, 20 people are on ventilators in the hospital. In total, 39 people have died. Many of the most recent cases are in people who have returned from travel, including from the U.S., which now has the most cases in the world. Yet the American president is considering sending troops to the border with Canada to protect that country from us. Our Ottawa Bureau Chief Mercedes Stephenson broke this story. Mercedes, with this surge in cases in the U.S., all the people dying there, how is putting troops at the Canadian border supposed to help?
Well, Donna, a lot of Canadians and Americans question how it would help. What I'm being told by sources is that the U.S. president and officials in the White House believe that it would help to detect people illegally crossing the border from Canada into the United States. Now, there's not a lot of people who do that compared to the number who cross from the U.S. to Canada, but with the COVID-19 crisis, President Donald Trump and his officials are saying that they don't want migrants with quote-unquote diseases, as a leaked Border Patrol memo called it, coming into the United States. So they want to deploy the military along the border to help make sure that doesn't happen. President Trump was asked about this at his press conference today, and here's what he had to say about why he's thinking about deploying troops along the border.
Well, we have very strong deployments on the southern border, as you know, with Mexico, and we had some troops up in Canada, but I'll find out about that. I guess it's equal justice to a certain extent. You know, we have a lot of things coming in from Canada. We have trade, some illegal trade that we don't like, and we don't like steel coming through our border that's been dumped.
Donna, a lot of people on both sides of the border are very concerned about this proposal. Historically, the border has been non-militarized. That's something that Prime Minister Justin Trudeau said he thinks is in everyone's best interests. Deputy Prime Minister Chrystia Freeland using much stronger words, saying she believes that this would be unnecessary and damaging to the relationship. I'm told that Canada has been pushing back very hard against this in private, and so have a lot of officials in Washington who think this will be damaging to an important relationship with an important ally.
Mercedes, do we have any idea what the U.S. troops would do near the Canadian border?
So this would be under 1,000 troops, and they'd be deployed about 30 kilometers from the border. They'd be using remote sensor technology to pick up people who are crossing the border. Then they'd feed that information to the U.S. Border Patrol agents who'd be able to go out and interdict these people. They're not allowed to enforce laws themselves as U.S. troops, but they can provide that military intelligence to border agents to try to capture people who are crossing illegally. Donna?
All right, Mercedes Stephenson in Ottawa, thanks. A new report on the global impact of COVID-19 spells out in staggering terms where this could all be headed. Experts at Imperial College London, who do disease mapping and modeling and advise governments, project this, and brace yourself, the numbers are huge. In the absence of any interventions, this virus would have infected 7 billion people, they say, and killed 40 million. Mitigating the spread with interventions, which so many countries are doing, and the number of deaths could be reduced by half to 20 million. Still, healthcare systems in every country will be overwhelmed, especially in poorer countries. It's only by suppressing the spread through testing, isolating infected people and their contacts, and strict social distancing that the report says the death toll will be reduced further. And here's the part that's most crucial in this report. Delays in implementing strategies to suppress transmission will lead to worse outcomes and fewer lives saved. Well, parts of the American healthcare system are already overwhelmed. According to Johns Hopkins University, there are now more than 83,000 confirmed cases in the U.S. That is the most in the world, and more than 1,200 Americans have now died. The pandemic has shut down large parts of that country's economy. A record 3.3 million Americans filed unemployment claims last week. That's nearly 5 times the previous record. New York State is the epicenter, and it is clear now political leaders there waited too long to take decisive action to limit the spread. Jackson Prosco reports.
New York's hospitals are already past the breaking point.
9/11 was nothing compared to this. They just keep coming. And they're all ages. Don't delude yourself into thinking only the old will die.
Doctors and nurses overcome by the sheer number of coronavirus patients as the epidemic ravages America's largest city.
Hell, biblical. I kid you not.
At Elmhurst Hospital, where 13 patients died in a single day, the line for coronavirus tests stretches around the block.
They all have COVID.
The New York Times obtained video from inside, where staff are underprotected and overwhelmed. A refrigerated truck has been brought in to store bodies.
The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming.
At other hospitals, nurses wear garbage bags as gowns as supplies of protective equipment run low. Tents have been set up to serve as makeshift morgues.
Almost any scenario that is realistic will overwhelm the capacity of the current healthcare system.
The state's governor continues to plead for more ventilators and supplies from the federal government, but there's stiff competition.
The problem isn't just that the cases are growing every day, it is that they're growing rapidly every day.
New Orleans could run out of ventilators within a week. Every ICU bed is taken at Atlanta's 4 main hospitals. The stress on the system from COVID-19 now risks the lives of other critically ill patients.
If they're unable to, because the system is otherwise overloaded, there will be an increase in morbidity, an increase in deaths.
The White House is now working on a plan to categorize various states as high, medium, or low risk in an effort to reopen parts of the country. The unintended consequence of that, though, is that one state may now discriminate against residents from another. We're already seeing it happen. Rhode Island says it will pull over New Yorkers, and Texas says it will force people from New York and New Jersey into quarantine. Donna?
Jackson Prosco in Washington. Thanks. In this pandemic, Italy still has the highest death toll. More than 8,000 people have died there. Spain is second, more than 4,000 lives lost in that country. About 14% of those infected in those countries are healthcare workers. Doctors and nurses are among the dead. As Crystal Gamansing reports, the scale of all of this is hard to grasp.
It is the most grim of deliveries. Truck after truck dropping off bodies at an Olympic-sized ice rink turned morgue. In Spain, more than 4,000 people have died and many more lives are on the line. Spain's King Felipe toured a new military hospital. He hopes it will ease the heroic and intense daily battle being waged by doctors and nurses. A battle shared by those in Italy. Despite the situation in Spain, Italy is still the epicenter of the European outbreak. Infections surged again, and police in Rome ramped up spot checks. Fines for breaking the lockdown went up to 4,000 euros.
This virus is very dangerous. If you remember, we have been saying for more than 2 months now, this virus is public enemy number one.
That enemy is still spreading daily.
We must look out for each other. We must pull each other through this. Because if there's one thing that is more contagious than this virus, it is love and compassion.
Compassion also means financial support. 37 billion euro is on the table to help members of the European Union get through this health crisis. Crystal Gamansing, Global News, London.
Coming up, the vital lessons Canada can learn from other countries. As Canada deals with a surge in COVID-19 cases, we can learn from countries who are ahead of us in this outbreak. Extensive testing, isolating those who are sick and their contacts, and physical distancing are crucial to suppressing the spread of the virus. Wait too long to do that, and it's too late. As Eric Sorensen reports, this is a crucial time for Canada.
Germany's chancellor learned weeks ago the importance of keeping apart. Staying off the streets was adopted early in Germany, and testing is big. While Canada reached 120,000 tests this week, Germany is testing 120,000 every week.
Wir haben es früh erkannt.
We detected it early, says this senior health official, because we tested it early. 43,000 Germans have contracted COVID-19, but with remarkably low mortality, 1 death for every 200 cases, half the rate in this country. Canadian doctors are learning from countries with even just a few more weeks' experience.
We have set up a specific social media group where we exchange any new information that we come across. But I think we're in a dynamic situation where we're forced to treat and learn at the same time.
It's a crucial time for this country to stay on top of the outbreak.
The critical period of days is measured after a country reaches 100 confirmed cases. Canada reached that date on March the 11th. Since then, the cases have surged past 1,000, 2,000, towards 3,000. And the curve is bending upwards. Japan has done a better job than most countries of flattening the curve, attributed by some to a mask-wearing, obedient population. Other countries have been at this much longer. Canada has a fraction of the number of cases of China, which is over 80,000. South Korea managed to bend the curve down with a massive testing program to below 10,000. Italy didn't get started soon enough. Same thing for Spain, and maybe most worrying of all is the United States. All of these are arcing upwards, which suggests that cases are doubling more quickly. The goal for Canada then is to get Canadians to stay home and bend that curve downward over these next critical weeks.
Whether Japanese diligence or South Korean thoroughness, being rigorous makes a difference. The path ahead for Canada remains uncertain.
Our pandemic infection rate is still growing exponentially in Ontario and in all of Canada. Over the next 2 weeks, hopefully we'll start to see that the rate of increase is slowing, which would indicate that the social distancing measures are working.
Canadians may yet need to take more measures, but we have the experience of other countries to show what works and what doesn't. Eric Sorensen, Global News, Toronto.
Survival on surfaces still ahead. Expert data on COVID-19's screen time. The first case of COVID-19 was confirmed in Canada 2 months ago. Since then, a whole lot has changed. Throughout this crisis, we've been trying to ease some of your fears and your confusion by putting your questions to the experts. Jeff Semple has more answers for you tonight. Jeff?
Donna, Canada's health minister says she expects between 30 and 70% of Canadians will become infected with COVID-19. And of those cases, around 20% will be serious and may require hospitalization.
Hi, I'm Marilyn. I'm from Calgary. What would the average stay be in the ICU with the COVID-19 virus?
Global News took a tour of this intensive care unit, where hospital staff are bracing for a rush of COVID-19 patients. Some may need to be hospitalized for months.
The sickest patients with COVID-19 have what looks like a pneumonia on both sides of the lungs that require a lot of oxygen to be given.
Around 200 Canadians who were infected with COVID-19 have now recovered, released from hospital, leading some to wonder whether they might now be immune.
Hi, my name is Ali Bakr. I'm from Fort McMurray. If someone recovered from COVID-19, is there a chance to have the virus again?
That's a really good question that we just don't have the answer to yet.
There haven't been any confirmed cases of someone catching COVID-19 twice, but some viruses, such as influenza, mutate rapidly, which is why people can catch the flu again and again.
You know, every year it's a slightly different virus that we're tackling with. And we don't know enough yet about this new coronavirus if it mutates as quickly as influenza.
Hi, my name is Dory. I'm calling from Vancouver. I have some questions about the coronavirus. I want to know how long it lives on surfaces such as cell phones, tablets.
A recent study found that COVID-19 can survive on plastic surfaces, like a smartphone case, for up to 3 days, while similar viruses have been known to survive on glass surfaces for up to 4 days.
Your phone is about 18 times dirtier than like a public restroom toilet seat.
This Toronto company is scrambling to supply hospitals with these smartphone sanitizers. The microwave-like devices blast bacteria and viruses with intense ultraviolet light. They've sold twice as many units last month than all of last year. Now, if you can't afford your own UV machine, you can also clean your smartphone with one of these, a wipe with at least 70% alcohol. And if you don't have one of these, Donna, you can also just wet a cloth with some soap.
Good old soap and water. Jeff Semple in Toronto, thank you. The latest tool in fighting the pandemic. Next, some promising research coming out of New York. The race is on across the world to come up with rapid test kits, treatments, and a vaccine for COVID-19. As Heather Yureks West reports, they could be game changers in this pandemic.
Researchers in New York have significantly advanced the science that will help the world fight back against COVID-19.
It's important because we can now actually identify individuals who already have had COVID-19 and are immune to it.
When people get infected, the immune system reacts, and the immune system produces what we call antibodies. And these are chemical substances in your body that can attack the invading germ.
A team at the Icahn School of Medicine at Mount Sinai has developed a blood test that can detect whether people have antibodies to COVID-19 in their blood. It's a critical development for a number of reasons.
It'll give us a handle on who was exposed and who wasn't. So if this virus comes back in a second or third wave, we'll know who is unprotected and who's protected.
We know that not everyone infected with COVID-19 has symptoms, so an antibody test is the only way of determining who's been exposed and who's now immune. This is a vital tool, particularly when it comes to identifying those with immunity within the health system.
These people can actually treat critically ill patients. They can treat patients who are contagious, so they don't have any risk of infection.
Having this test may also help with treatment. Some patients who have recently recovered from COVID-19 have blood rich with antibodies, and this blood, known as convalescent plasma, can be used to treat up to 2 other patients who may be critically ill. On Thursday, New York's Mount Sinai Hospital announced it's now using the therapy to treat COVID-19 patients in its ICU.
It's very exciting as a virologist to be able to contribute in a time like this.
The New York researchers are now sending the protein used for their test to labs around the world, hopeful their work can lead to the next big advancement in the race to stop the spread of COVID-19. Heather Urix West, Global News, Calgary.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight we leave you with a nightly salute to healthcare workers in Vancouver. At 7 p.m., people step on their balconies and porches to cheer and clap and bang pots and pans, a way to thank healthcare workers and a noisy and loving way to say, we're in this together. Thanks for watching and take care of yourselves.